Have you ever heard of retinitis pigmentosa? Well, retinitis pigmentosa is a genetically inherited condition, typically autosomal dominant. This primarily affects the peripheral component of a patient's vision and can take, honestly, a couple of decades before it manifests. So, there's these things that we'll see in the examination in the peripheral retina that develop called bone spicules. They're kind of like these black pigmented things that look like a T, and they kind of scatter around the peripheral edges of the retina and can affect a patient's peripheral vision, specifically in lower levels of light or just in general daytime function. But it doesn't affect a person's life as far as health concerns or any other issues when it's just retinitis pigmentosa by itself. These patients can go on to live healthy, normal lives just with some peripheral vision loss. And from the patients that I've seen that have had retinitis pigmentosa, it usually impacts them somewhere in the later teens and 20s, sometimes the 30s, just depending on how long it manifests. But usually their night vision becomes a little bit more poor. Sometimes the peripheral vision during daytime conditions becomes a little bit more poor. And it's just a little bit reduced and kind of frustrating. But it just mostly impacts the peripheral vision. It doesn't creep in on the macula or anything weird like that. It just kind of stays in the peripheral sections of the retina to impact the patient's peripheral vision that way. There are many different types and styles of genetic inherited conditions of the eyes. Sometimes retinitis pigmentosa patients will often have a family member or two or three that has this condition or is a carrier for this condition as well too, which is why it's very wise to get genetically screened and tested if you do have a family member or someone that you have blood relation with, that you may carry the same gene, or you may be experiencing the traits of that gene, which is the development of retinitis pigmentosa. It can be kind of a devastating diagnosis at first, but a lot of patients actually live pretty healthily with it. And there are some conditions that can impact the overall health affiliated with retinitis pigmentosa, but usually it doesn't impact the health of the patient when it's just retinitis pigmentosa by itself. So that's a condition you'll want to talk to your eye doctor about if you have any questions or if you have any genetic screenings that come back with that gene marker. And again, it's commonly associated with an autosomal dominant gene inheritance pattern, but you'll want to talk to your geneticist, you want to talk to your physician, you want to talk to your eye doctor just to get some further questions answered and what they're seeing and what you're seeing, so y'all can be on the same page with that. If you like this video, give it a thumbs up, subscribe to the channel, and tap the bell for notifications. I'm Dr. Bryce Heffington. We'll see you next time.